Hi everyone. In this video, today let us discuss various drugs used for the treatment of obesity. Obesity is one of the physiological condition which is associated with excessive body weight, and sometimes we can use another term overweight. The overweight and obesity are associated with abnormal accumulation of the fat which results in the increased body weight. But there is a small difference between these two conditions which can be categorized by using one of the index, body mass index, which is commonly known as BMI. This BMI is a ratio of weight of the person with respect to height of the person. So BMI is the body weight of the person per each square meter of the height, which is measured in the units of kg per square meter. This BMI can be used to differentiate the obesity and overweight. People can be classified as overweight with body mass index greater than or equal to 25 kg per square meter. On the other hand, obesity is classified as BMI index greater than or equal to 30 kg per square meter. So with little difference between this BMI, both overweight and obesity indicate some abnormal accumulation of the fat leading to excessive body weight. So ideally the BMI should be maintained less than 25 kg per square meter, and when the BMI of the patient reaches to 30 kg per square meter, it can be considered as obesity. This obesity may lead to so many systemic complications because of accumulation of the fat. If it is untreated, it may lead to cardiovascular complications resulting in stroke, and it may also result in the accumulation of the cholesterol, which may lead to atherosclerosis, narrowing of the blood vessels with fatty deposition. With excessive body weight, the patient may have high blood pressure. That's why in order to reduce the blood pressure, the control of the body weight is one of the important aspect. By reduction of body weight, the blood pressure can be reduced by 5 to 10 millimeter of mercury. Many of the times obesity is associated with diabetes. The elevated levels of the blood glucose, which also leads to systemic complications targeting many of the organs and increasing the effects of obesity. Finally, with increased body weight, there will be more stress on the musculoskeletal system. So obesity may lead to some muscular disorders resulting in muscle pain, muscle spasm and muscle weakness. That's why it is very essential to control the obesity and overweight. So today in this video we are going to see what are the different types of drugs used for the treatment of obesity, which are used along with diet control and proper exercise in order to reduce the body weight, to reduce the systemic complications. Now let us list out the drugs used for the treatment of obesity. We have various drugs like Orlistat, Phentermine, liraglutide, semaglutide. These two drugs are belonging to the same category because they are having the same suffix glutide. Similarly, we can use the combination of the drugs. We have the well-known combination Naltrexone plus bupropion. This combination can be used for the management of obesity along with diet control and exercise. And Phentermine can also be combined with another drug, topiramate. This topiramate is one of the anti-epileptic agent. So this anti-epileptic agent can be combined with Phentermine to produce control on the appetite and food intake. Now let us go one by one and let us discuss the different types of drugs, how they work, what are the important side effects and doses of these medications. Let us start with the first one, Orlistat. Orlistat is one of the lipase inhibitor. Within the name of this drug, we can observe the suffix stat. The stat indicates it inhibits the enzymatic activity. So Orlistat inhibits gastric as well as pancreatic lipase activity. And this drug acts as a reversible lipase inhibitor, so that whenever this drug is going to be stopped, again the lipase activity can be restored, which is required after the stopping of the therapy. And this drug, by blocking the lipase activity, it inhibits the breakdown of the triglycerides into free fatty acids. By intake of fatty food, the fat is going to be absorbed into the systemic circulation. But Orlistat can reduce the absorption of free fatty acids, thereby it controls the body weight. So this drug can be given along with the diet control and proper exercise to control the obesity. This drug can act on the duodenum where triglycerides are going to be normally absorbed. Here lipase is one of the important enzyme which acts on the triglycerides so that it produces a breakdown of the triglycerides into free fatty acids. These free fatty acids are going to be absorbed into the systemic circulation. Now this step is going to be blocked by Orlistat. Orlistat inhibits the lipase activity such that it inhibits the breakdown of the triglycerides. Therefore triglycerides are not absorbed, instead they are excreted within the feces. This reduces the fatty deposition, thereby it reduces the body weight in the patients. This Orlistat can be given at a dose of 120 mg given thrice daily, and this drug, because of decreased triglyceride absorption, it can produce few of the side effects such as fecal urgency, oil spotting, and oily stools can be observed with use of Orlistat. On long-term therapy, Orlistat can also develop the renal stones, where care should be taken to avoid the nephrolithiasis, the formation of renal stones in the patients. Second drug is the Phentermine. Phentermine is classified as an anorectic agent. This drug acts as a sympathomimetic, and another drug within this category is the diethylpropion. Both of these drugs are classified as anorectic agents which reduce the appetite, and these drugs are amphetamine derivatives. That's why they can act as sympathomimetics. So they can stimulate the sympathetic system, and because of increased sympathetic activity within the CNS, they can reduce the appetite, which reduces the intake of food, thereby it reduces the body weight. Within the hypothalamus, norepinephrine plays an important role to control the appetite. Now Phentermine acts as amphetamine. It can be taken into the nerve terminal through the norepinephrine transporter, where for exchange of Phentermine, one of the norepinephrine is going to be leaked out and it acts on postsynaptic receptors. In this way, Phentermine can increase the release of norepinephrine into the synaptic cleft, which increases the transmission of norepinephrine, thereby it reduces the appetite within the hypothalamus. So Phentermine is a sympathomimetic which reduces the appetite by increasing the noradrenergic transmission within the hypothalamus, which controls the appetite centers. This Phentermine should be taken before the breakfast, and it can be given at a dose of 37.5 mg in the form of Phentermine hydrochloride. This 37.5 mg Phentermine hydrochloride is equivalent to 30 mg of free base Phentermine. So in the salt form, the dose is somewhat different. It is given as 37.5 mg. Since this drug acts as a sympathomimetic, this drug can produce effects of sympathetic system. So Phentermine can produce the elevated blood pressure. It can also increase the heart rate, resulting in tachycardia. It can increase the palpitations, awareness of heartbeat. And on long term, this Phentermine can also increase the valvulopathy. It can produce the inflammation of the cardiac valves, which may reduce the functionality of the heart. But rarely this drug can produce the valvulopathy. The common side effects observed with Phentermine is the elevated blood pressure and tachycardia. And already we have discussed that Phentermine can be combined with another drug, topiramate. Topiramate is an anti-epileptic agent, but this drug can be combined with Phentermine to reduce the appetite. In this combination, Phentermine is given at a dose of 7.5 mg and topiramate is given at a dose of 46 mg, which is the recommended combination of these drugs to control the body weight. Third one is the liraglutide. Liraglutide is one of the GLP-1 receptor agonist, glucagon-like peptide 1 receptor agonist. We have another drug, semaglutide, which is having the same suffix glutide. These drugs are having few of the advantages. They can bind to albumin so that they are somewhat long acting, and they are given as subcutaneous injections. Normally glucagon-like peptides are metabolized by DPP4 enzyme, dipeptidyl peptidase 4 enzyme, but liraglutide and semaglutide are not metabolized by DPP4 enzyme, so they are having high bioavailability. Because of all these advantages, liraglutide and semaglutide are nowadays one of the good drugs to control the body weight. These drugs can also reduce the excessive glucose levels, so they can be used as anti-diabetic agents, as well as they can also reduce the excessive body weight, and they can also reduce cardiovascular complications. Because of all these beneficial effects, these drugs are nowadays can be used for the management of obesity. So these drugs can act in different ways. They can act on the CNS to reduce the appetite, and they can also produce delayed gastric emptying, which reduce the absorption of fat as well as glucose. Finally, they can act on the pancreas to increase the insulin release, which controls the excessive glucose levels. By all of these actions, liraglutide and semaglutide can control the body weight as well as elevated levels of glucose within the body. That's why these drugs can be used as both anti-diabetic agents as well as to control the overweight in the patients. So in those patients who are associated with excessive glucose levels along with BMI greater than 30 kg per square meter, these drugs can be used to control the body weight. This is the beta cell. This beta cell is expressed with glucagon-like peptide 1 receptors, which are the G protein coupled receptors. Now drugs like liraglutide can act on GLP-1 receptor as agonist, which activates the adenylyl cyclase system, resulting in release of cyclic AMP. This cyclic AMP then activates the protein kinase A, which increase the entry of calcium, resulting in the release of the insulin. In this way, liraglutide and semaglutide can increase the insulin release, which controls the glucose levels. And apart from this action, these drugs can also reduce the appetite within the CNS and produce a delay in the gastric emptying. By all of these actions, they can reduce the fatty absorption. Fifth one is the naltrexone and bupropion. This is a combination of two drugs which are belonging to the different categories. Naltrexone is a opioid antagonist, whereas bupropion is an atypical antidepressant. So both are different drugs, but this combination can be used to control the body weight. And these drugs are combined in a single tablet as an extended release tablet. This tablet releases these drugs in a slow fashion, thereby it can produce pharmacological effects throughout the day. And since both of these drugs are combined in a single tablet, the patient compliance is increased with this combination. Now naltrexone acts as a opioid receptor antagonist, and this drug increases the POMC activity. Pre-opiomelanocortin activity is required to control the appetite. So when this POMC activity is increased within the CNS, it can reduce the appetite centers, thereby it can reduce the food intake. Similarly, bupropion is an atypical antidepressant which increases the dopaminergic transmission within the CNS, thereby it increases the POMC activity. Here bupropion mainly acts on the dopaminergic neurons. It can block the dopamine transporter, which is responsible for reuptake of dopamine. When this transporter is inhibited, the dopamine is more released within the synaptic cleft, which increases dopaminergic transmission. When this dopaminergic transmission is increased within the CNS, it can increase the POMC activity. Similarly, naltrexone acts on the mu receptors expressed on corticotrophic cells. Normally, mu receptors are going to inhibit the POMC activity, but naltrexone acts as a mu receptor antagonist, thereby it can eliminate the inhibition, which results in the increased metabolism of POMC to release the products like alpha MSH, melanocyte stimulating hormone, which acts on the MC4 receptors to control the appetite, thereby food intake is going to be reduced. This combination can produce few of the side effects such as induction of seizures, because naltrexone is a opioid antagonist which can increase the risk of seizures, and they can also increase the heart rate, resulting in the tachycardia. Even they can increase the blood pressure, and this combination can also increase the risk of intraocular pressure, so it may increase the development of glaucoma in susceptible patients. Apart from these side effects, naltrexone and bupropion is an effective combination to control the body weight, where naltrexone is given at a dose of 8 mg and bupropion is given at a dose of 90 mg. So both of these drugs are combined in a single dosage form as extended release tablet. Sixth one, other drugs. We have few of the other drugs which also reduce the body weight. Already we have discussed diethylpropion, which is this drug is an anorectic agent just like the phentermine. This drug can be given at a dose of 25 mg thrice daily, 1 hour before the meal, to control the appetite and food intake. Similarly, another drug is setmelanotide. This drug can be used for the chronic management of obesity, and it is given at a dose of 2 mg as subcutaneous injection once daily. Previously, one more drug is there to control the body weight, that is lorcaserin. This drug acts on the 5-HT, but nowadays this drug is not used for the management of obesity because of development of cancer. So this drug is withdrawn as an anti-obesity medication. So these are the various drugs to control the body weight in the patients with obesity and overweight. Still, we have few of the other drugs which are used to control the body weight as an off-label purpose. That means they are not approved by FDA, but still they can be used to control the body weight. And few of the drugs like zonisamide can act as a appetite suppressant, which is actually classified as anti-epileptic agent. Similarly, phentermine is a amphetamine derivative which can be used as an anorectic agent to control the body weight, but nowadays these drugs are less preferred and they are not approved by the FDA. So the best drugs to control the overweight and obesity are classified as 7 categories. The first one is Orlistat, second one is Phentermine, third one is liraglutide, fourth one is semaglutide, fifth one Naltrexone and bupropion combination, and even Phentermine plus topiramate combination can also be used. And miscellaneous drugs like diethylpropion and setmelanotide are also used to control the obesity. So that's all about the drugs used for the treatment of obesity. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.